Welcome, everyone. Thanks for joining us. We're about to get started. Just getting my Apollo on here. What vibe are you on, Stephanie? Oh, you're on mute.
Oh, there we go. I'm on focus right now. I have it on focus.
Nice.
Yeah.
I'm on social.
Oh, that's
Maybe I'll
good.
get.
That's good.
I'm gonna get on your vibe.
Yeah. Awesome.
All right. Well, I think we have a good number of folks in here now. So why don't we get started? You ready?
I'm ready. Let's do it.
All right. Welcome everyone back to another Apollo Neuroscience webinar. I'm your host, Dr. Dave Rabin. I am a board certified psychiatrist and neuroscientist and the chief medical officer, co-founder and co-inventor of the Apollo technology. I'm also a psychedelic assisted psychotherapy practitioner trained in both ketamine and MDMA assisted therapy, and run a holistic psychiatry practice and training for clinicians in holistic and integrative psychiatry, which is kind of where mental health is going in the 21st century. And I'm also the executive director of the Board of Medicine, which helps to educate clinicians on how to improve practice and update practice based on the discovery of new technologies and new medicines and how they help to teach us about the world. And today, um, I'm very excited to talk to you about women and sleep and women's health in general, because this is an area of science that was not well studied up until recently, because most people don't realize that women were actually excluded from almost all clinical trials for a very, very long time. And so, and there were a number of reasons for that, but regardless, we don't know a lot and haven't had a lot of updated information over the last 100 years around women's health. And so this is what we're going to be focusing on today with Dr. Stephanie Estima. And Stephanie is the founder of Hello Betty, and uh, she is a community centered. It's a community centered around female empowerment, and she is a doctor of chiropractic medicine, and a special interest in metabolism, functional neurology, and female physiology. And she is a podcast host and has hosted me and many other amazing speakers on her and experts on her show. And we are just so excited to have her here to catch us up on the latest on women's health and sleep. So thank you so much for having us. I mean, thank you so much for being here with us.
I'm delighted. I'm delighted. Thank you for the invite. And I hope that everybody that's on this webinar and who receives the recording afterwards is going to get a lot of value from our conversation.
I have no doubt at all. And I just wanted to make sure to run through some of the ground rules for us with the webinar so that people understand how to interact with us and how we'll answer questions, because there will be Q&A and we love to hear questions from you. Our team will be on the webinar with us today, answering questions that come in that we can answer. And we will be also, using the Q&A box, not the chat function. So if you have questions today, please type them into the Q&A box and we'll be answering them on the fly. And we'll try to run through as many as we can. If you have any questions about the Apollo wearable specifically, or questions about trying to learn how to use it, or how to get the most out of it, please reach out to our customer service team, because we won't be able to, we won't have time to talk through all of that today. And we will not be able to answer your personal medical questions. So don't take any of this as medical advice that's directed to you. This is more of an update on all the latest findings and how to make the most of them in our lives. And if you have questions about your personal medical situation or health, we recommend that you talk about that and bring this up, what you're learning today, with your provider. So again, Thank you so much, Dr. Stephanie, for joining us. I would love to start out by just asking you, could you tell us a little bit about yourself and your passion, how you found your passion in this space?
Sure. Yeah. So, as you mentioned, I'm a doctor of chiropractic, and I have always had a love affair with the neuromusculoskeletal system. So, brain metabolism, and how that translates into the way that we think, the way that we look, the way that we perform, the way that we feel. And in my practice, we were running, when I was still in private practice, we were running nutrition programs, started noticing diverse outcomes between men and women. So men were having usually really great outcomes. They were losing fat, they were improving their testosterone, all the things that we were hoping for in terms of the outcome for men. And this exact same protocol for women was, either sort of working or failing miserably. So I started really experimenting really with my patients in terms of how we might manipulate nutrition, exercise protocols, stress management protocols, sleep protocols for a woman who's cycling, and how those things might change over the course of a cycle. And so that was my first body of work that I put out into a book. And now that I myself am in perimenopause, starting to see some changes, at least physically, emotionally, and very, very interested in the stage of my life and my community. I have a large community of women who are also typically perimenopausal or menopausal, who've been told, just, suck it up, buttercup. This is part of aging. Get used to it. It's all downhill from here. And really here to change the narrative through exploring lifestyle modifications. And then when necessary, exploring hormonal replacement therapies and like their efficacy, their safety, all of that.
Yeah, I love that, and I'm so glad to hear that you're doing that work and putting that out into the world, to shift our perception about some of these phases of life that are actually important for us to go through. And I was actually just I had a wonderful interview with Kim Anami yesterday, who you might know, and
Yes.
um, so we talked about how she brought up actually something I didn't know, which was that in traditional tribal culture and in First Nation culture in America, that they believe that menopause is an important part of life for every woman, where the body transitions from one that is focused on producing and recreating to one where it's more internally focused and conserving energy for access to higher states of spiritual enlightenment, which is so interesting. And it's just when you think about the way that different cultures interpret these different life phases, it really makes you think that that there may be lots of different understandings of these parts of life, and why they're important. And that that also brings me to a question that I wanted to ask you, which is, we all go through cycles in our lives, and women go through cycles more often than men, right? There's the menstrual cycle in and of itself being 4 phases every month changes the female body. And so there's a lot that I think we are not taught well about. That's the menstrual cycle and those phases and what happens to women's bodies during that rhythm.
Yeah.
And so could you talk a little bit about about the menstrual cycle, maybe some of the common misconceptions and how that impacts sleep for women?
Sure. Yeah, I think this is a great place to start. And it's interesting because I have, as I mentioned, a lot of women in my community, perimenopausal. And one of the first things that we tell them is start tracking your cycle. And it's usually the first time, maybe they're 40 or 45 or 48. And they're like, why didn't anyone tell me? Why didn't anyone tell me to track? So when we look at the menstrual cycle as a whole, the average menstrual cycle is somewhere around 29 days. So actually follows more of a lunar cycle for any of you that are lunatics, such as myself, having reverence for the moon. The menstrual cycle is about 29 days, but there's some variance in terms of what we consider normal there. So you can go 24 days, 35 days, somewhere in that range. All of that's considered normal. Within the length of the menstrual cycle, there's 4 distinct phases, as you mentioned. So there's the menstrual phase. This is bleed week. This is the most obvious part of the cycle. This is when there's blood. We are, using a cup or a pad or a tampon or whatever For most women, that's going to be 1 to no more than 7 days. The average bleed is about 3 to 4 days. So most women, somewhere between 3 and 4 days, will be bleeding. The second phase after that's what's commonly called as the follicular phase. And actually, technically, the follicular phase is bleed week and week 2 of the cycle, but day 6 to 14 essentially is the follicular phase. And this is where we'll see, and I'll talk a little bit about hormones, and I know that we're going to come back and double click on them, but this is where we will see surges of estrogen, particularly estradiol. We'll see surges of testosterone. There's some other hormones that we see surging right after that. One's called luteinizing hormone. And then we have the third phase is the ovulatory phase. This is the part of the cycle where we are releasing an egg from the follicle for the purpose of, being fertilized. Whether or not you want to become pregnant or not, there's different strategies to impart during this time, but that's what's happening, and that's most women will ovulate depending on the length of the cycle, somewhere around day 14 to 17 ish. And then, of course, depending on your age, the egg is going to be viable for less and less time. So the younger that you are, the egg is viable for something like 48 hours. As you get older, maybe it's 24 or even less than that. And so after ovulation, we move into the luteal phase, which is just the remainder of the cycle. So that's going to be, let's say, day 18 to when you start bleeding again. So that might be day 28, 29, 30, whatever it is. And so normally, I know that this is a conversation on sleep. The reason why I brought up estrogen, and actually I did forget to mention progesterone. So in the luteal phase, we will also see a surge of progesterone. And you actually require, in order to get progesterone, you need to ovulate. You will not produce progesterone if you are not ovulating. So normally I bring this up because estrogen has a boosting effect on a neurotransmitter called serotonin. Many of you may have heard of this. This is sort of our happy hormone. It improves our mood. It helps to promote sleep. And of course, in the luteal phase, progesterone, think of it as progestation. It's like the pro-pregnancy hormone. This is going to facilitate relaxation and, again, also be very sleep promoting as well, because it activates, upregulates inhibitors in the brain, or inhibitory neurotransmitters like GABA, things like that in the brain.
And
Yeah.
it also for the, since we're talking about this for the context of fertility, the progesterone secretion and release is really critical because it helps to create the endometrial lining to help it thicken so that it can support a fertilized egg, right?
Yeah. Yeah. It's
And
actually,
so,
yes.
yeah,
Sorry.
go ahead.
I was just going to say, it's actually, it's amazing. Every single month, we are literally creating a new organ, and we are creating a 5-star hotel, right? So your body is putting everything, all the good stuff in there. It's putting all your minerals, like you have the zinc and the selenium and the magnesium and the copper and all the things that a potential fertilized egg might require. And so we actually see, when we actually look at our metabolomics or our metabolic rate in the second half of the cycle, it's actually increased, right? Like there's almost like a frenzied push to create this beautiful environment, this nutrient rich, dense, environment for that fertilized egg. So it's just, I know I've been studying this for a long time, but I just have such reverence for, the capacity and the capability of creation that the female body has.
Yeah, I mean, it's absolutely, stunning, right? The idea that the female body is every month, especially, I mean, we'll focus on when the body's healthy, right? But every month that the female body's healthy, the body is going through a cycle of creating the base infrastructure for the creation of new life, and then creating the support system to actually make that happen.
Yeah.
And that, and I think two things I take from that, because I talk to a lot of women about this, and what I've learned is that many women don't realize that that period of when the female body is capable of supporting new life and creating new life is really only certain times during the month. And so that's why cycle tracking is so important, because there are many times during the month when, for people who are trying to get pregnant, that that you can't have fertilization occur because the body is not prepared to support it for
Yeah.
for a number of reasons. So
Yeah.
understanding when your ovulation phase is happening, and when that's about to start, and knowing the signals of your body when you start to enter your ovulation phase is really important to the fertility process, and also to understanding your sleep, because as you were saying, during certain phases when estrogen is higher and progesterone is higher, that sleep that's a stage that is, if I correct me if I'm wrong, but that's a stage that is more facilitating of better, deeper sleep. Whereas the
Right.
stages where there's lower estrogen, lower progesterone, like the menstrual phase and the luteal phase, or no, sorry, the follicular phase and the menstrual phase, those phases are where women may sleep less well and might need more support.
Correct. And it's also, when we think about normally we should see, to your point, we should see as we see estradiol surge, we'll typically see that in the follicular phase and then it drops off right around ovulation. And then there's like sort of that secondary rise in the luteal phase, as you mentioned. And so if there's a woman who I'm sure that there's a woman listening who may have, it would be me if there's no one else, like, who had suffered from PMS in the luteal phase. This is usually because there's an imbalance in those two hormones, right? So there's that progesterone and estrogen. What we want is we want more progesterone in the second half of the cycle than estrogen. But oftentimes there are a variety of reasons why this may happen. Age is one of them for sure, but there can also be environmental toxicants. There can be many things that can sort of promote more estrogen than progesterone. And then, of course, what happens is that woman is going to have a harder. She's going to feel more inflamed. She's going to, I wrote about this in my first book. Sort of like very tender, angry, almost breasts, like a lot of water retention. So like putting on your rings is very difficult. Falling asleep is going to be very difficult. Your temperature modulate, like you're going to be hotter and more uncomfortable. So those things can also happen. Like there's a lot of potential for dysregulation, we'll say, when we have an imbalance in some of these hormones. And certainly, I know we're going to talk about different ages as well. But the other thing I wanted to just point out is that sometimes there's also a difference between men and women in terms of our sleep cycles as well, right? So women actually we tend to have or require a longer total sleep time, and we have less total wake time. So meaning that the duration of our sleep needs to be longer than our male counterparts. And then when you're sort of looking, if you have an aura ring or something like that, where you're looking at the different stages of sleep, there's times overnight naturally where we are awake, right? You may open your eyes or you're just, the brain waves that are present at that time would classify you as awake. And so we have less total wake time. And then the other thing that I'll just mention as we sort of start getting into the weeds here is that women tend to require going to bed earlier than men. So if you have a male partner, let's say, you're going to need to go to bed earlier than him. So if you both are going to bed at the same time, maybe you've watched a movie, like whatever you're doing in the evening, um, that's going to also mess up your circadian rhythm, which I know we're going to talk about today as well, which could also then start contributing to the insomnia or that perception of that less restorative sleep as well. So there's some differences that's also important. We have the menstrual cycle, but there's just some other general sex specific differences in terms of our sleep quality between men and women that also dictate how we should be sleeping, when we should be sleeping, and maybe what our wake times should be as well. And so I wrote about this in the book, my first book, but women can have a longer total sleep, like anywhere from 15 to 45 minutes longer. That's like a significant chunk of time. So just something to keep in mind for those of you that are listening that may be sleeping with a male partner, that your sleep requirements are distinct.
Yeah, that's great to know. I didn't even know that the way that you're describing it. I'm learning a lot. This is very helpful. Even for men who are listening who have female partners, it's
Yes.
helpful.
It's for the
Um,
women and the men who love them.
right,
Yeah.
exactly.
Yeah.
Um, yeah, I've always wondered why Catherine and I require different amounts of sleep,
Yeah.
because we have similar energy levels, but you know, for she always required more sleep than I have,
Yeah.
and it's not. but we have like what's interesting is we have similar chronotypes. So going on this idea of like circadian rhythm, um, our circadian rhythm is our sleep and wake cycles,
Right.
and that's the way that we think about what if we were talking about the four-phase menstrual cycle a minute ago, but all of us, men and women, have what's called a diurnal cycle, which is circadian rhythms, meaning when the sun comes up and the temperature gets warmer and you start to smell the smells of the morning, you start to wake up and your melatonin levels start to decrease and you start to gain energy and clarity and focus so that you can do all the things you need to do during the day. And then
Yeah.
as the sun sets and the air gets cooler, then and it gets darker, we start to have melatonin increase again and we go through another hormone cycle that helps us wind down and fall asleep. And when I see there's one thing that I see, and many of my colleagues see, and I think this has been fairly well published on now over the last 20 years, especially, which is that in our patients and in many people who haven't even actually made it to the doctor yet, we see that dysmenorrhea or amenorrhea, where these are the medical terms for either for not having normal menstrual cycles, and we know that there are a lot of downsides for women not having their regular monthly menstrual cycle or
Yeah.
having that be not the way that not as cyclical or regular as it should be. And two of the things that we see that have been widely published on now are the impact of sleep issues and not sleeping well, not sleeping deeply, having a disrupted circadian rhythm, shift workers, right? People who work jobs and who do things that result in irregular sleep and wake time. So that seems to be a major contributor to having abnormal menstrual cycles, and also having more premenstrual symptom issues.
Yeah.
And then there's also the other side of it, which is stress,
Yeah.
right?
Hmm.
And we see that having a huge impact on the health of women's menstrual cycles. And so I think, could you talk a little bit about that? And then we'll get into ways that we can start to fix it.
Sure. Yeah. I mean, I think stress is, well, first I'll say that all stress is not bad. I think that there is a tendency to poo-poo on all stress. So some stressors are really good for us and they actually help to promote sleep. Things like exercising, things like even temperature manipulation, which I know we'll talk about today being, I like to actually take a sauna about an hour or so before I go to sleep because that really helps my rebound, get my core body temperature low. We'll get into all those details later. So those are examples of stressors or stressors that are acute in their nature, but the long-term adaptation to them actually helps us achieve the things that we want to, whether it's with our health and our sleep patterning. Um, but then there's what I think you were referring to is like distressors or things that are chronic in their nature that are not removed from the environment or from the individual's life. So this can get a little off topic, but so there's a couple different ways that we can look at these stressors. I often, certainly as a perimenopausal woman, looking at my community and listening to what they're saying, I often talk about this stress sandwich. So there's these environmental stressors sort of coming from above with aging parents and now needing to take care of them and taking them to doctor's appointments and managing their, physical ailments, medical, medications and whatnot. And then if you've had children, your children in perimenopause are teenagers. And this is, I have some young teenagers now, and this is really where the parenting really begins, like they were really cute when they were, prior to getting into their teens. And now they got attitudes and they got opinions on things. And so
Yeah.
I sort of call that the stress sandwich because that woman now in her 40s or 50s is now taking care of these aging parents. And it's also very difficult to watch your parents get sick or pass away. And then, of course, the stress that comes with sort of your children
Yeah. It's a
growing.
huge role transition.
Yeah, yeah. And there's also, I think, with even myself, I found myself maybe a year or so ago just grieving a little bit the loss of children. Like they were little and depended on me for everything. And I really took a lot of love and pride in raising them. And now they don't need me as much. So there's a little bit of oh, okay. So now what do if I'm not 100% mom like all the time, who am I and what do I want to be doing? So there's that kind of questioning that can also come
Yeah.
up. There are other stressors, of course, as well. A lot of women, very common ones are occupation, occupation related. So not really loving the work that they're in, or maybe having conflict at the workplace, also conflict in the home as well. So, maybe their partner, it could be family, conflict with family members, that kind of thing. And these are things that sort of persist and perseverate over time, right? Like they don't ever, you have to see your boss, let's say every day. You have to see your partner or your family members on, some kind of regular cadence. And that can cause a lot of stress, and it can really it can start to change the ratio within the body in terms of how our sex hormones are produced. So your body's always going to prioritize survival over reproduction. Like reproduction is, and we haven't talked about it yet, but like, sympathetic and parasympathetic nervous system, they're part of the autonomic nervous system, and your stress or, fight or flight is like that sympathetic. It's like the proverbial tiger in the room. You're either going to fight the tiger or get away from it. And then the parasympathetic is more your, rest, digest, stay, and play, right? It's the relaxation, it's procreation, it's all of these wonderful things. So your body is always going to prioritize your sympathetic system, even if the threat, let's say your boss is not technically a threat to your life, but your body doesn't have the ability to distinguish between it can't discern between that and a tiger. So there's this constant flood of catecholamines in the body. Cortisol, of course, being a very famous hormone that is going to prioritize the way that your blood is distributed, your sex hormones that are produced. So I know that that's like a mouthful, and I could start rambling here, but that's sort of like a back of the envelope. Like that's sort of what can happen in terms of when you have a stress that is chronic and low grade over time, it will absolutely mess up your menstrual cycle.
Yeah, I love the way you describe that. And I think this is really important for everybody to understand who's listening, because, and to share this with your friends, because, even in medical school, I don't know if this is the same for you, but even in medical school and, all the years of medical training that I did, we were never taught about how the parasympathetic rest and digest recovery nervous system and the sympathetic nervous system work together constantly in the background. That part we were taught, but what we were not taught was that you can influence their behavior by breathing and by doing, healthy amounts of exercise and some of these what we call hormetic stressors, which is when you put the body under stress in a safe environment like sauna, cold plunge, or going for an intense bike ride or run, or doing any of these things that
Right.
the body can grow from. That is just a short-term burst of safe stress that creates growth opportunities for us. And that is something that's really important to how we learn and how we heal and how we recover. And we can strengthen that nervous system over time, just like we build muscles in the gym. And that's also that nervous system, the recovery nervous system that governs reproduction and digestion and immunity and sleep, is governed by the vagus nerve, which many of you, I'm sure, have heard about. And just to kind of tie that together, what I hear you saying is, and of course, when we're talking about distress, like the stressors that you mentioned, being like overwhelmed, overstimulated, too many responsibilities in life transitions, all these things, and then you combine that with sleep disruption, right? Which is another source of chronic stress.
Right.
And sleep is where we get our deepest, most effective recovery. Like deep sleep is where we get almost all of our physical recovery. REM sleep is where we get almost all of our mental and emotional recovery. So if we're
Right.
not getting those, then we are more chronically stressed. And so that would turn up activity in the fight or flight survival system in the background all the time, because we're not recovered, we're not getting that recovery we need, and we have all the stress from day-to-day life adding on to that, and it just builds up over time. And then that takes resources away from the reproductive system that makes sure menstruation and the monthly cycles are going the way they should, right? And then if there's no resources or less resources going to the reproductive system, because the body's perceiving that we're in a survival threat all the time, running from a tiger. We don't want to think about reproduction when we're running from a tiger. So
Right.
basically,
Right. Hopefully not.
nutrient
Yeah.
right, because then we wouldn't survive. So
Yeah.
nutrient depleted reproductive system means dysfunction in the menstrual cycle. Is that
Right. Right.
is that basically what you were saying?
You said that perfectly. Yes.
Oh, good. Yes, I got it. But I think that that understanding is really important because that's the part, that whole story of what's happening in terms of like the resource allocation problem, right? We only have so much blood and nutrients to go around. So if our bodies perceive us to be in a threatened state where we're worried about our survival or we feel unsafe physically, emotionally, mentally, spiritually, what have you, then we can't, or like evolutionarily, we cannot divert resources to reproduction, immunity, digestion, sleep if we're worried about running from a tiger in that moment, right? And so that's where we start to get into these critical practices that we all should have been taught as kids, but it's never too late to learn, that help to rebalance our nervous system and train us to be more recovered, more resilient, more healthy despite the stress that's coming in and despite not having sleep. And so how do we, so you mentioned some sauna cold plunge. We talked about and we talked about a couple other briefly, like techniques that build resilience in the body. And then there's soothing techniques like soothing touch, soothing music. You know, that's where Apollo comes from. And other techniques, empathic listening, right? Human connection, intimacy. There's so many different areas we could go in, but what would you suggest are the top tools that you recommend to people to improve their sleep and their resilience, to, you know, have a more regular cycle and health as women?
Sure. I think that there's varying degrees of like there's no cost things that you can do, all the way up to investment pieces like the Apollo that you can invest in. So I would say starting right at the bottom, everybody, irrespective of age, and actually it gets more important as you age. I think that we can be getting early morning sunlight. Again, we've been talking about circadian rhythm, and just because I'm a nerd, I'll just, when we think about the word circadian, DN, like the second half of that word means day, and then circa means around, right? So around a day. And if you speak any other language, you know that like the DN is like Spanish is dia, Portuguese is dia or gia, like it's so that sort of it's around a day. And we've also been talking about the infradian rhythm as well. So infra means beyond. So infradian means beyond a day. It's just like infrared is beyond the red light, right? So um, getting early morning sunlight is a way to reset is maybe a bit of a vague word, but it's the best one that I have right now, is to help reset our circadian rhythm as we age for women specifically, because we are seeing, this is both for, I've seen some questions about menopause and perimenopause coming up in the Q&A box. As we are starting to see estradiol or that estrogen level decrease, that actually affects not only our menstrual cycle or our infradian rhythm, but also our circadian rhythm. So women, I mean, almost every menopausal woman, that's the biggest comment that I make is sleep, or that I get is sleep disruptions starting in perimenopause and persisting through to menopause. So I would say early morning light. The sun is at a low solar angle, typically, maybe before 10 a.m., even earlier if you can. Like if you can get up, sort of brush your teeth, wash your face, and then kind of get outside and get some early morning sun, that's the best. We see a lot of blue light and green light at that time, which is going to stimulate areas of the brain that are going to start driving, your metabolic processes, all the things, right? So early morning light, I would say certainly exercise, and I would say resistance training is my bias. I do cardiovascular work as well, but I would say resistance training has a couple of different impacts on the female body. One is going to be, mobility. It's going to help us become stronger. It's also going to have a impact on our menstrual cycle. Typically, when we are resistance training, it tends to balance out. We were talking earlier at the top of the hour that progesterone and estrogen differential that can go a bit wonky in the luteal phase of the cycle. Resistance training actually promotes balance there. And then, of course, resistance training also has a metabolic effect as well. So it's the three M's, right? Mobility, metabolism, and menstruation. So the metabolic effects, of course, is that over time, this stress or the hormetic stress adaptation is that you are going to be driving up your metabolic rate because you're putting on muscle tissue, which of course is a metabolically active tissue. It requires a lot of calories to sort of sustain it. So you burn more calories over time, the more muscle mass that you have. So those are sort of two things where I would start every single woman is like early morning sunlight, starting to do some resistance training. And there's a lot of resources in terms of if you've never, I'm 46, so I grew up in the, cardio bunny era, right? So it's like all about high, low and step classes and all of that. So if you're around that age or even older, you know that most women grew up in the cardio machine area of the gym, like they weren't in the weight room. So there's a lot of resources in terms of how you can get started and like how you can start implementing things like progressive overload. It's a webinar onto itself, but resistance training. I would also say in terms of diet, there's a lot of things that you can manipulate in the diet as well. So as we age, we need to have more protein. It's more satiating. It helps us reduce, snacking. It helps to preserve that lean muscle tissue. Trying to reduce our I would say overall carbohydrates. I don't like to blanket statement because it's going to be different for each individual. But generally, if you're having trouble sleeping overnight, let's say sleep has become an issue for you, maybe thinking about a transient, temporary reduction in carbohydrate to see if that changes things. And if not, sometimes what's required is actually you need more carbs at night. I actually like to give a cocktail of like honey and some tea in the evening for people who wake up overnight. So you have to play a little bit with the diet. And then like the Apollo, right? So the Apollo and that's why I'm so proud to be an Apollo partner and to be working with you and to have hosted you on the show. It's just like a warm hug. I don't know how else to describe it. It feels like I actually under your counsel, I wear it on my wrist during the day when I'm in focus mode, but at night you had given me the piece of advice to put it on my ankle and to do the sleep
Mm-hmm.
program. And I just love that. That's how I use it. So I would say that there's options, sort of, there's a really broad spectrum in terms of where people might want to choose to start. It can seem overwhelming if you're, 45 or 48 or, you're 35 or whatever it is, and you're not sleeping. Just choose one of those things and then master it. So maybe I'm just going to get out every day this week and get some early morning sunlight, and I'm going to track my sleep. The other thing I'll say that's like no cost would be just waking up at the exact same time. I know we just had a time change, so people are sort of reeling from that a little bit. I know I certainly do, but trying to
Yeah.
wake up generally at the same time, trying to go to bed generally at the same time, within 15 or 30 minutes, I think will be incredibly beneficial as well.
Yeah, that's a great point. And I think I love the way you describe the natural free stuff we can do first, because that is something that's accessible to anybody who's listening to this. Even today, you can start right away without spending any money, just by starting to go to bed at the same time, try to go to bed at the same time every day, every night, and wake up at the same time every morning within like roughly a half hour. It doesn't have to be exact, but that is extremely helpful for your circadian rhythm cycle and what we call circadian structure, which then creates a certain level of reliability and safety around your day-to-day schedule. One of the things that we talk about in mental health is that the single biggest source of anxiety is having uncertainty in our lives,
Right.
right? And so what we do when we feel uncertain or out of control is we start to do things, whether they're helpful to us or not, that make us feel more in control of our lives. And that can cause a lot of problems, and often results in our anxiety accidentally getting, spilled on other people. And so we can actually learn to regain control over our lives by focusing on some of these very simple techniques that Dr. Stephanie was explaining, which are, making sure that you set aside time and prioritize time as if you would for work or anything else that's important to you, to get like 20 or 30 minutes of exercise every day. resistance training is a great goal for everybody. But if you can't do that, even just going for a walk can be really, really helpful to just get energy that's stored up out of your body. If you can do resistance training, as Dr. Stephanie described, good on you. That's even better. And I think to your points about how that can help um, provide more eustress and more positive benefit hormonally for the female body is really interesting. I actually didn't know that. And then getting morning sunlight, again, similar to the waking up at the same time every day and going to bed around the same time every night. That morning sun sends photons to our skin that and our retinas that result in a rapid reduction of melatonin, because it signals to us that, hey, it's daytime, right? It's time to have energy and clarity and focus and time to be a productive human being. And if we get that on a regular basis, we start to restore and create more certainty around the hormonal state of the body and things that we don't have to make decisions on as much anymore. And I'm so glad to hear you're having such a great experience with Apollo, because part of why we developed it was to help people restore and create more rhythm, more structure around rhythms in their life. And I use it the same way that you do, which is mostly for sleep, but also for giving me energy during the day, because it helps me to, be awake when I need to be awake, and then be sleepy when I need to be sleepy, so that my circadian structure is strong. And that builds resilience for me in my life, which is so useful. And also helps me just get deeper, more restful sleep, so I can wake up the next day and not feel like crap. But again, I think and for anybody who needs support on helping, build these natural rhythms, if you've tried to do these on your own, you've tried to exercise and create a routine around that, and it's been hard, Apollo can be a tool that can help.
Yes.
But the free stuff is always there. And the whole goal of everything we're talking about is to learn how to do the free stuff and then build that into a routine in our lives, so that we can create these natural rhythms that are not requiring assistance from anything outside of us.
Yeah. Yeah. Couldn't agree more.
And so maybe moving into later phases of life, we've talked a lot about menstruation, the menstrual cycle.
Yeah.
Could we talk a little bit about how we know that also, you brought up menopause and perimenopause. We haven't talked that much about pregnancy and postpartum,
Mhm.
but sleep is also a struggle for many women in these phases. And for different reasons, but I think a
Yeah.
lot of it tends to be hormonal related. In pregnancy, there's obviously other things going on with carrying a baby and having to sleep in different positions and all that kind of thing. And postpartum, there's nursing for many women. But can you talk a little bit about how sleep is impacted these different phases and what women can do to navigate that?
Sure. Yeah. To your point with pregnancy, I mean, we're also growing life. There's, there's a occupant at the five-star hotel, as we were mentioning before. So a lot of women, certainly you have think like your whole body is essentially working harder, right? So overnight, a lot of women, and this happened to me as well, it's like lots of trips to the bathroom, right? Like you have more blood volume. So your kidneys are working harder, which means that you're just producing more urine, which means that you're just going to be, going overnight to the bathroom. And then of course, as the baby gets bigger, more pressure on the bladder, so you're going to have that sensation to want to void as well. So you have that, your heart is working harder again, same reason, more blood volume, it's pumping, trying to pump more volume throughout the body and to the baby. Um, that might also make it difficult in some ways to sleep, because you might feel like your heart is racing, or you might just feel it sort of pumping in your chest. Same thing, shortness. There's other things like shortness of breath, where, in the beginning of your maybe first trimester, some of the pregnancy hormones like progesterone and others can almost make you breathe more deeply. And then as the baby gets bigger, second trimester, third trimester, now the baby's sort of butting up against the diaphragm, which is going to sort of feel like you don't have the capacity to take a deep breath. Because what happens, of course, diaphragm is this umbrella like muscle that depresses when you take a breath in, but it can't really go anywhere because it's sort of, bumping into the baby.
Right.
Um, And then I'll say what I remember this with being pregnant with both of my boys. I had the craziest dreams. Like I had the most vivid, and they were just so, it was like I was in chocolate land. It was like all these like crazy, crazy dreams. So there's that. And then you have the anticipation of like, hopefully everything goes well with the pregnancy and I'm going to be a new mom and all of that. So there, I would say that for pregnant women, certainly there's going to be some things that you just can't get around, right? You can't get around the baby's feet butting up against the diaphragm. You can't get around the pressure on the bladder. What you can do is you can think about just doubling down on sleep hygiene. So things like, not having caffeine late in the day that's going to stimulate both you and the baby as well. So like soda drinks, coffee, anything that's sort of caffeinated. I would even say liquid consumption. If you are, if you want to try and cut off your liquid consumption like 2 hours before you go to sleep so that you have a chance for the liquid to sort of work its way through the body. You can void before you can go to the bathroom before you go to sleep. We mentioned sauna. I wouldn't necessarily say sauna, but like a warm bath in the evening to sort of, or a warm shower that can sort of help relax some of the muscles and sort of prepare you for sleep is always a good idea. And then other sleep tips that I would say to someone, whether they're pregnant or not, if you have blackout blinds, try to make sure that there's a reduction. If you can reduce the noise, like close your door. If people in the house are still awake, things of that nature, I think are going to help. Postpartum, again, we have a mom who's just had this physical and chemical and emotional 9 months of growing human life. And now, this is when the game really starts, right? This is when we're starting to actually take care of the human. Um, you are going to have disrupted sleep postpartum because your baby doesn't have the established circadian rhythm that you do. They're going to be waking up multiple times overnight for feedings. And they've been in an environment of darkness, right? Like they don't have the sun the way, or, I mean, to some effect, some light, I guess, comes in through the stomach, but they're not exposed in the same way that you are. So there is going to be that disruption when the baby is very young. I would say the old adage of like nap when the baby naps, like try to make up the sleep deficit through the day with like more phasic sleep. So you're not going to get 8 hours of sleep, or maybe don't have that expectation. And if it happens, you can be delighted. But if it doesn't
Celebrate.
happen, yes, yeah, you can celebrate. But generally, sleep when the baby sleeps, take a lot of little naps through the day to try and make up for it. And then the other thing I'll mention, and I wrote about this in my book as well, is try to share the load. Like the baby is not just mom's responsibility. It's hopefully there's a partner there who can help support you. Maybe the dad or whoever the significant other can take the baby for a walk. Maybe mom can lie down and have a rest, or and what have you. So if you can share the burden of the caregiving somehow, maybe it's your mom or an aunt or your significant others, other people who can help with the baby in those early days are going to be incredibly helpful. And then eventually your baby will develop a circadian rhythm like you, and you'll start to see the baby start sleeping for longer and longer stretches overnight. But there has to be just a certain acceptance that it's going to be difficult in the beginning, and then you just have to take the sleep where you can get it.
Yeah, that's a great point. And I think it's not to be not the power of community and family is not to be underestimated, right? Like having people around to support you through this process is critical. And
Yeah, yeah,
traditionally, if you look at ancient cultures, nobody raised children in isolation, right?
right.
We always raise children in community. There are always other friends and family members around, and raising children was like a communal effort. And
Takes a
I think
village, right? That's what they say. Takes a village.
exactly. Exactly.
Yeah.
Um, so I think that's a great place to actually transition to some questions from the audience if you're up for it.
I'm game. Yeah, I would love. I've been seeing some come. I see your team is so great. They're answering so many, but I would love to take any questions if I can.
Yeah, I have some really good ones for you actually that we've
Okay.
we've saved up. So first
Okay.
one is, aside from estrogen, how important is the role of testosterone in sleep?
Oh, this is a good question. Yeah. So testosterone, for women, we don't, so men typically have more of a steady decline in testosterone. We typically will call it something like menopause or andropause, something like that. Testosterone, to my understanding, doesn't have quite as a critical role in sleep promotion as estrogen might, and progesterone. We do know, when I'm sort of thinking off the fly here, certainly oxytocin is related both to estrogen and to testosterone. We used to think it was only sort of estrogen, like it was only part of the estrogen pathway, but we know testosterone and dopamine are now very intricately connected to oxytocin, which is the love hormone, bonding hormone. Um, so to that extent, intimacy, let's say in the evening, where you are intimate with someone and you're promoting, that oxytocin or that bonding, can certainly help with a night's sleep. But I don't know if there's any that I'm familiar with, at least off the top of my head, testosterone specifically, and sleep.
Yeah, that's really interesting. I would tend to agree with you. I haven't read that much about the impact of testosterone on sleep, although I think that anecdotally in men, we would probably, in times where testosterone is higher, men probably don't sleep as well. If I had to think about the natural phases of when men's testosterone is higher, but I haven't seen that much about that and the role of testosterone in sleep
Yeah.
specifically.
Yeah.
It would be interesting to look at folks to see if there's been studies of like testosterone
Yeah.
replacement therapy in men and women and see how
Yeah.
that's impacted.
That's a good
But
question. Yeah.
yeah, it's a really great question. That actually leads to the next question, which is very similar, which is, can you talk about how hormone replacement therapy for women could impact sleep?
Yeah, great. So I'll state my bias in so far as I'm a fan of HRT. So hormone replacement therapy, I think, has gotten a really bad rap. There are many reasons why that is, which are beyond the scope of this webinar. But I'll say that for most, certainly first and foremost, this has to be a conversation with your primary healthcare provider. And I think that hormone replacement therapy can be something that, to some degree or another, whether it's progesterone or estrogen, progesterone, or what have you, I think can be standard for women. When we think about the menopausal transition, uh, just to give you context, your sex hormones, and we're talking mainly about estrogen and progesterone, there's more of a sort of gradual decline of T. They drop to 1% of their previous levels. So that is,
Wow.
and we started off this conversation talking about estrogen and its serotonin, boosts serotonin, which helps with feeling calm, and progesterone helps with relaxation and upregulating these inhibitory transmitters in the brain. So we have 1% of that. So HRT or hormone replacement therapy, be it progesterone to start or eventually estradiol and progesterone, or estrogen, I should say, and progesterone, or depending on if you have a uterus, like there's all these different sort of algorithms, like do you have a uterus, do you not have a uterus, like, and that will sort of dictate what kind of HRT you're on. But certainly, HRT for many women is a game changer for sleep. I hear so often women wake up, they're 47, and they just can't sleep. Like they were sleeping like babies before, and now they can't. And there's a lot of reasons why that is. Like that overall decline in, like that sort of drop down in progesterone, that overall decline in estrogen. That is going to affect your sleep. But as a menopausal woman, we want to be thinking about some of the lifestyle modifications that we were talking about, like the early morning sunlight and like nutritious diet and resistance training, going for a walk,
Right.
bedtime and sleep hygiene. And once you sort of mastered those foundational basics, you can also incorporate HRT into that. And I think a lot of women, it's like a light bulb, you're like, oh, this is the piece that's been missing for us. And I think that, my own comment on this is I think that women have suffered for far too long. And I think it's time to really change that.
What about is that the same for postmenopausal women?
Postmenopausal women, I don't know. So if you are like, I just see something, I'm 73 years old. What about me? So if you sort of miss the bandwagon, let's say, I think that still it needs to be a conversation with your primary healthcare provider. I know anecdotally and clinically, I have women who are 65 who went through the menopausal transition like 15 years beyond, like 15 years past um, when they went through menopause, got on HRT and felt 100,000 times better, right? So they felt so much better. So it's not that it's an impossibility, but we do have to be thinking about risk, right? So and there's always a trade-off. Like you do anything, there's always a trade-off. So, your age is going to play a significant, your family history, your general fitness levels, all of these things are going to they're going to play into your own personal, bio individual risk levels. Certainly, we do see when we start, even women who are in the peri and menopausal transition, we do see elevations in some risk for some disease states. So they're not high, but they're still there. And so I think that
Yeah.
it's important that we are discussing all of these options with our patients, whether they're 73 or they're 53, whatever it is. So I think that it's a possibility, and you have to discuss it with your PCP. You have to talk to your primary healthcare provider, and then they're going to be able to look at your personal health history, and then you two can make a call together.
Yeah, that's a great point. But I think that to answer the question, that there is a lot of promise from HRT, and
Yeah.
and I think that for helping women feel better and sleep better. So it's definitely worth a conversation with your doctor. And just to wrap the topic of hormone replacement therapy, because there's been a lot of conversation going on around like intravaginal estrogen applications and things like that are
Yeah.
not oral HRT. They don't require like systemic treatment. They're
They're
just
not
local to a
systemic.
certain.
Yeah, they're just local. Yeah.
Yeah. So
Mhm.
is that the kind of thing that you're talking about as well for most women?
Certainly, if a woman, if I don't see it anymore, but there was a woman that's like, I'm 73 and what about me? So if she is, she has a partner or she's sexually active or she's noticing changes, dryness, poor lubrication, pain with sex, that kind of thing. There's also, as you mentioned, there's estrogen that you can insert vaginally that can help just locally the tissues. It's a very absorptive area, so this is not going to get into the system. Another thing that a lot of women will use is estrogen on the face because we are vain. We want to look our best, right? So estrogen also will have benefits to the appearance of the skin that's also not going to be systemic. So like the oral, when we're taking oral estrogens, this is going to be, systemic, but, generally the topical, certainly if you're just putting it on the face or the intravaginal estrogens are going to be just absorbed locally.
Yeah, that's great advice. Thank you. Because I think a lot of people are confused on that topic.
Yeah. Yeah.
Um, and so to the next question, do you think it's possible to reverse perimenopause if a woman balances their nervous system more effectively with sleep, diet, stress management, and all the things we're talking about?
So just a point of clarification. So you're not going to reverse perimenopause. That's like 100% of women are going to go through, if you have ovaries, you are going to go through, and if they've been extracted, you are going to go through menopause of some
Right.
kind. But I
It's
think
going
what
to
she's trying
happen
to
at some
say is
point in
like
your life.
like, can we reduce the symptoms, right? I think that's the general direction of the question is, can we
Yeah, or
reduce some of these symptoms?
yeah, or slow it down, maybe was maybe another way to think about what she's
Yeah.
asking. But yeah, maybe not make it progress less quickly to
Yeah.
full on, yeah, postmenopause.
Sure. And I mean, yeah, so there's a couple of different ways I want to answer this. So I'll say from the beginning, certainly managing your symptoms, bringing them down to almost nothing is absolutely possible when we are thinking about diet manipulations, sleep hygiene, which I hope the whole takeaway of this conversation is that is the panacea for recovery and performance and showing up in your life. If you're sleeping well, you're eating well, you're moving in a way that's appropriate for, your body, you are going to naturally be balancing some of the hormonal sort of dysregulation that can happen. Will you avoid the perimenopausal drop in estradiol and progesterone? No. Uh, can you prolong it? It's a good question. I'd say maybe. Part of it is, I think, genetically determined. Part of it is also, and there's epigenetic determinants as well in terms of how those genes are living, which is what we've been talking about: the diet, the movement, the stress management, the sleep. Um, can you slow it down or extend your fertile window? Is an interesting question. I think that there's some debate in the community around whether or not that's a good thing. Do you want to be 60 and have the chance of becoming pregnant? Is a like, do we want a 60-year-old to have a child? Like it's a
Well,
like, I certainly don't want to become a new mother at 60. I want to be a grandmother, So like
right.
I
Yeah, and yeah, no, this is a really interesting topic. I know we don't have time to delve in this today, but I've been meeting more and more women who are pregnant in their 50s.
yeah.
I
Yeah.
met a woman the other like this just a couple months ago who's 57 and pregnant, or
Wow.
53 and pregnant. It was just
Yeah.
I've never seen like outside of the what we call in the medical world like the high risk OB unit at the hospital. I don't often meet people like that, and I was really impressed and just by the fact that the female body was even capable of that was
Yeah.
really new knowledge to me. And when I talked to my colleagues who actually work in the OB units, they were telling me that the average age of women who are now in the high risk unit for delivery is something like 49, 50 years old. So
Wow.
we're starting to see this extending of the window of fertility
Yeah.
much greater than the original studies from the 1890s showed, of course, but even more than I think we ever thought. And I
Yeah.
think there's a question of, I think we still don't know if there's a downside that's significant. I think there's many studies that have shown that there is a downside of advanced maternal age. But now some of those studies have been debunked, and maybe it's paternal age that's more important. I think we're still in the dark a little bit about this. But you bring up a good point that we should probably, think about it carefully.
Yeah. Yeah.
Another question for you. I should say, I want to be extra respectful of your time. We're 1 minute over. Do you have a couple more minutes?
I have a couple times. Yeah, I'm certainly happy to go a couple minutes over.
Okay. Awesome. Next question. So we have a question about sleep and people who wake up in the middle of the night wanting to know if there's anything that they can do to help themselves fall back asleep. In in uh, in our world, we don't really have in the psychiatry and sleep medicine world, we don't have a lot of tools that help people fall back asleep other than deep breathing, cognitive behavioral therapy for insomnia, and progressive muscle tension relaxation
Yeah.
exercises, which is just
Yeah.
stretching when you're in bed. And then that's why we developed Apollo, which is the first product that helps to do that. But have you come across anything in your world that helps women or men to fall back asleep when they wake up in the middle of the night?
I would say that I'm familiar with the CBT and the progressive muscle relaxation as you are. And I think one of the things that I've often said to my patients, and I've said this publicly, is just lying down, even if you're not asleep, is still restorative. Like, I think that there can be this like orthorexic anxiety or this panic that you're not sleeping. And then that's going to start this whole physiological cascade of like being stressed, like, oh my God, I'm not sleeping. I'm still not sleeping. And,
Right.
it kind of just gets worse and worse. So, you
What's
know,
wrong with me that I can't sleep?
why can't I do this? Like, it's so supposed to be natural, So I think just understand, if you do wake up, it happens. It happens to it happens to everyone. It happens to me. You're not supposed to sleep perfectly every single night. I think in modern life, it's very difficult to do that. What Dr. Michael Bruce was on the show, and he was saying, if you have like a couple, like one or two bad nights of sleep a week, like that's pretty normal. And I thought that that was such a lovely permissive opening because people feel like they have to sleep perfectly all the time. So I would just say lying in your bed with your eyes closed, feeling grateful that you have a bed, that you have beautiful linens, all those things is still restful. And then as Dr. Rabin was saying, you can sort of think about relaxing. I often will cue people to like relax your toes, and now relax relax the top of your foot, relax your heel, relax your ankle, sort of moving all the way up the body. And that can be very relaxing and help to allow for that sleep to recommence.
Yeah, that's a great point. I'm glad. Thanks for walking people through the progressive muscle tension relaxation exercises, because I think when you combine that with breathing, before I had Apollo in my life, when I combined that with breathing, I could knock myself back to sleep almost every time within about
Yeah.
3 minutes. It's a
Yeah.
very, very powerful technique, but you just have to practice, and you just breathe slowly in and slowly out as you stretch, and then be aware of your toes and your feet and all the different parts of your body. And then, it's definitely more effective than counting sheep. Um, so another question, I guess, is a question about melatonin. I think I can answer the first part and then I'll pass it to you. I think the first part is what's your perspective on taking melatonin for sleep? And I think, melatonin is a natural hormone that our brains make.
Yeah.
So it's okay to take it for sleep, but like all things that we put into our bodies, the dose is really important. And the timing of when you take that is really important because melatonin is a circadian rhythm hormone. And so if you don't take it at the right times or you take too much, then you can not get the effects that you want. And you can, if you take too much, actually decrease your body's own natural release of melatonin. So in general, what most people don't know is that two things: you're supposed to take melatonin usually 60 to 90 minutes before you actually want to fall asleep. Some people who are really sensitive can take it 30 minutes before, but generally speaking, it's 60 to 90 minutes before you actually want to be asleep in bed. And number two is you want to take under 1 milligram of melatonin.
Yeah.
So when
That's a
the
big one.
when the brain naturally releases melatonin, it's somewhere between like 0.5 and 1 milligrams roughly or less. So
Hmm.
we don't want to take much more than that. When we take that sweet spot, that's when people tend to have the best effects. Have you seen this as being effective in women at any of the phases that we're talking about, or being helpful
Yeah.
along the way?
Yeah, so like our sex hormones, melatonin also declines as we are moving through perimenopause and menopause. And it's usually around like 52, 53 years of age. I've seen some comments here saying like I take it and then I melatonin seems to make it worse and I'm in menopause, I can't stay asleep. So I think that the lower the dose, I think is super important. Melatonin supplements, it can be like the wild, wild west. Like I've seen super physiological levels at like 10 milligrams of melatonin per capsule, which is insanity. One of the things that I have no affiliation with this company, but I do recommend it a lot. It's a plant-based melatonin supplement, and I learned this from Dr. Michael Bruce, and I started using it clinically as well, and I thought it was really great. It's called Herbatonin, so I have no affiliation with them. I don't know anybody there. Not there's no code or whatever to get a discount, but it's a great product. I think it's a plant-based melatonin, and it's 0.3 milligrams, which is very similar to your point around what the brain is able to produce. So you don't want, and I think it was, if I'm saying, I think it's Jennifer who was saying like, I take it and it seems to get worse. Melatonin, sometimes when you take too much of it, you can just like pop right out of sleep. Like it'll kind of knock you out, and then you'll kind of pop right back out of sleep. So it might also be the dosage that you're taking. So I would potentially look at that. Maybe look at having a melatonin supplement if you're if you're menopausal, looking at something that has a much lower dose, and then some of the sleep hygiene. You're welcome. I see the thank you there. Doing some of the sleep hygiene tactics that we've been talking about too, I think is important.
Yeah, I completely agree. And I think that was a great place to end. So thank you so much, Dr. Stephanie Estima, for joining us. I really appreciate your time. I know how busy you are. And would you mind, can we wrap up by you leaving everyone with where to find you and anything you want them to check out?
Oh, wonderful. Thank you for that. I would say thank you everybody for your questions. This has been it's been a delight for me to spend time with you as well, Doc. If you want to find me, I have a podcast where Dr. Dave was on as well. It's called Better with Dr. Stephanie, and we explore hormones and exercise and nutrition and sleep and what it means to live a well-lived life. That's, free resource for you. I also have a newsletter that goes out every week. It's called the Mini Pause, which is my wordplay on menopause, and it's all action items for women who are 40 plus. All you have to do is just head over to my website and sign up there. So it's Dr. Stephanie, drstephanieestima.com is the website, and there'll be a pop-up there. You just enter your email and we send them out on Saturdays.
Awesome. And if you didn't get your questions answered today, again, thank you so much for joining us. We're happy to answer them. Just send them on over to us via email, and our teams will put them together, and we can, work into answering them on socials for you. And we love to hear from you. So you can follow me at Dr. David Rabin on Twitter and Instagram, and Stephanie, you're
Dr.
at
at
Dr.
Dr. Stephanie Estima. So doctor, first name, last
Right.
name. Yeah.
Yeah, that's what I thought. Okay, I just want to make sure. Thank you again for joining us, and thank you everyone for taking the time out today, and I hope to see you next time. Have a great weekend.
Happy World Sleep Day.
Happy World Sleep Day.